Hi, my name is Ginny from San Francisco, and I've been seeing Dr. Yu since the end of 2019. And I do have RP, and I discovered that I have RP back in 2017. It was very mild, and I was given the diagnosis that RP doesn't have a cure, which was very disappointing and more annoying than anything. And luckily, I was able to find Dr. Yu, who gave us a slight hope of containing this disease, and also hope that it would not progress as quickly as the regular doctor would say. So that's why I started to see Dr. Yu at the end of 2019. Yes, it is. This is my 6th year, and have been coming here consistently since then. And I've been coming here mostly every 3 to 4 months for 3 weeks at a time. And I find 3 weeks to give me the best results rather than 2 weeks, like most patients. So it helps. Well, unfortunately, RP is a very progressive disease. And I find that after COVID in 2020, and after I've taken the vaccine, it has really speed up the progression of the RP, of my RP anyway. And so every time I come now, it just helps constantly keeping the peripheral open and just giving me more clarity to be more independent. This time treatment, and as all my previous treatments this year, has been just keeping the peripheral and the lower field open as much and as long as possible. It's been pretty stable in that sense, I would say. I haven't had any floaters since the first year, and Dr. Yu took care of that, so that has not recurred. I've had recurring glares and fog issues, and both times that I've come this year, I came in with all of those issues, and within a week, that was the first thing that Dr. Yu cleared up, was the fog and the glares. And then after that, he was able to concentrate on getting the peripheral or more of the blind spots open up as much as possible. So I'm really happy with this 3 weeks result. This is my end of my third week, so it's been really a great progress. And usually after 3 weeks, I'm super happy going back because it's definitely much better than when I started at the beginning of the 3 weeks. So it's always a good feeling. Well, I consistently come and see Dr. Yu is because, well, one, I don't want to go blind, and two, I'm still driving. So I need to make sure that my peripherals are still clear and the blind spot doesn't take over. And Dr. Yu seems to have been taking care of that and still allowing me to drive so far. So just have to do it, because otherwise I'll just become dependent on other people. And without a car in San Francisco is really, or anywhere else, I would say, is very difficult. I just don't want to be dependent on anybody at this point. So also, you want to be able to walk by myself instead of somebody holding my hand and guiding me through. So it's critical for me to keep all of this up, all of my peripheral is open as much as possible. And I think it also works faster if I do come every 3 months versus every 6 months or once a year. So I find that the treatment, when I do it closer in time, it's faster for my blind spots or shadowed area to open up. And also it lasts longer, I think, as well. So it's all good. Well, there's a lot of benefits, because especially in my mindset and also confidence, because if you can't see clearly, it just makes life more difficult and frustrating. And when you get frustrated, then everything kind of goes downhill. I guess it's important to believe that Dr. Yu can and has always been successful in trying to keep my blind spot open and not, there are blind spots that are very stubborn, but most of them are still, every time I come for treatment, can still be opened. And I think that's the biggest benefit, is that if you do come for the treatment, there's a high chance of your blind spot opening up, versus if you don't come consistently, it might just permanently close. And then you lose the opportunity to have your vision corrected as much as possible. So I think that's a huge benefit, to come consistently and not give up. Because once you give up, you might as well stay home, because you will go blind. So that's pretty much what it is. High and lows of the week. I think throughout the week I do have good days and bad days. A good day would be I'll wake up and everything is clear. Even though I have some blind spot, but there's no fog, there's no glare. I can drive with confidence. I can do chores or do my work without having any type of fog. My biggest issue is fog and glares. So that would be a good day. A bad day would be major glares that I wouldn't even dare to drive. And I would have perhaps a lot of fog on the perimeter, like a halo type of deal. And then I have to keep moving my head up and down in order to see anything. And on top of that, the bottom field closes up. So I'll be more tripping over things or walking into things. That would be considered a pretty bad day. So I would say 2 bad days out of the week. So it's not too bad. Sometimes, because this condition really, excuse me, I think what really affects the bad days is if I had a bad diet day, no exercises, and just don't go out, perhaps, don't get enough energy going through my body. I think all of that affects the eyes. So to overcome that, do walks. Just go out, do walks. If I stay inside, sit and mope, it really doesn't help. It just gets worse. I think also, you said your mindset plays a lot into the condition of the eyes for that particular moment or days. I find that going out, walking, getting some fresh air is pretty much the best remedy when you have a bad day, because it does get your blood moving and more blood goes to your head, to your eyes. It does, and you just overall feel much better to overcome everything. And you just can't lose hope, otherwise it's just all depressing, and you definitely don't want to be depressed. It's the worst condition. Exactly. Just take yourself out of this bad situation and put yourself in a nicer environment, and then it really just changes everything. And it also takes your mind off of, oh my God, I can't see, or why is it going so bad right now? You just go out and do a straight line walk. You don't really need to need your peripheral at that time. You just go around, walk the block, or just stand outside and take in the sun, and just everything just feels better. I think that's the best remedy. I think the herbs helps a lot, and the herbs plus whatever the group of food that helps the eyes that Dr. Yu have listed, I think it would be consistent with both. And the exercises, of course, that helped me a lot. Get more consistent good days than bad days. So I might get 4 good days and maybe half a day that's bad, but I always bounce back, just as long as we're eating well, taking the herbs and doing exercises. I find that to be most helpful. All right. After 6 years, based on what I feel every time I come to a session with Dr. Yu, whether it's 2 weeks or 3 weeks, I feel that I always leave with a bigger field of vision, or vision field, and that's a huge encouragement to continue with all of this treatment. And then also when I leave here, going back with all the herbs and instruction for exercises. And sometimes Kathy texts me and said, "Are you doing your exercise?" So that's also helpful. So I think really to just be here and experiencing and feeling that after 1 or 2 treatments, there's already a difference, whether a little bit open or a lot open, it doesn't matter, it opened. Whereas I go back in my annual visit with my eye doctor in terms of SCO, it's always tests. Yes, compare last year with this year, fine, whatever. There's no solution. There's no encouragement at all. So I think at this point, I haven't gone back to my doctor for 2 years because it's just so depressing. I'll go to Dr. Yu instead, and at least, like I said, every time I come here, it's just all good because I see more. I'm able to see more, see clearly, got rid of my fog and glare issues. That was very important to me, and to be able to function as normal as possible when I get back. I think that's the biggest advantage with Dr. Yu. So there you go.